So I'm an emergency physician, similar to Jeff, just 3 hours away in Cranbrook, British Columbia, so right in the corner of the province. So the problem that we were facing was, we've seen increased patient numbers over the last few years. We've seen increased patient acuity over the last few years, over the last decade, and we've seen no corresponding increase in staffing over this time period. So, we're seeing greater wait times, we're seeing more frustration among our patients, and we needed a solution to address this. And what we realized is, we need to figure out how to improve patient flow in our emergency department with the resources that we've been given. And so we didn't look at just one simple solution. We looked at a collection of different changes to try to move that bar, try to improve the time from when a patient initially registers to when they initially see a physician. We looked at, we discussed a whole bunch of different options with our team. We settled on three main options that we believed would be, the easiest to carry out and that would have the greatest impact. And what we looked at doing is we looked at using all rooms for all purposes. We looked at standardizing the layout of every room within the emergency department, and we worked on efforts to improve the flow of paperwork through our department. With respect to results, things started off a little bit rocky. We tried to roll out a bunch of changes. They just didn't grab. And then, we took a few steps back and we realized we had to get greater engagement from everybody involved in this change. And without the people, on the front line involved in these changes, they just weren't going to happen. So, we took a few steps back. We had a bunch more meetings. We pulled in a bunch more people involved in these changes, and we managed to roll out a number of changes. And we saw about a 10% decrease in the time from a patient initially registering until seeing a physician, which was pretty close to what we were shooting for. We were shooting for, making a 20% improvement, and we managed to get to 10%. Another measure that we looked at in this project is, what did the people, what did the physicians with our department think about these changes? Did they feel these changes were improving patient flow? With respect to using all rooms for all purposes, this was universally seen by the physician group as being positive. With respect to the room layout changes, there was many people who were somewhat neutral about it because, we haven't finished the rollout of some of these things. These changes took longer than I believe they would take, and we continue to work on rolling out room change layout, and we continue to work on the paperwork flow. So, the big final summary, change is really hard. I'm sure we're probably going to hear that a lot. Change requires collaboration. It requires bringing in everybody who's going to be affected by this change. So those are my learnings, and I look forward to using this material and everything I've learned from PQI as I continue to push this project forwards over the next 6 months. And I think the changes we've seen so far are just the start of where we're going. Thank you.